I'm going to try and keep it up here, but there will be moments. The other thing is I'm South African, and so sometimes there's going to be words that we say a little bit differently. So I'll say calves when you guys mean calves. Right? My mom, whenever I call my mom, she's like, "Oh, you're sounding so American these days." And I'm like, "No, I'm really not." The other thing is that my contact information is here. Right? I have an extension appointment. This is part of my job. I serve more than the state of Kansas. So if you have a question about anything related to animals and insects and ticks, and you're in a pickle and you want somebody to talk it through or some advice, please feel free to reach out at any time. You can shoot me an email. You can give me a call. If I don't answer the phone, because I tend to forget that it's on silent, just leave a voice message and I'll get back to you. Okay, so we're all here today. Oh, by the way, this is my first time in Iowa. And I'm proudly Kansan, right? Like, I've only been there for about 5 years now, but I'm so proudly Kansan that I think this is the best place in the whole damn world. But I'll say, driving through Iowa, I'm like, man, Kansas, you gotta run for your money here. You guys have an absolutely beautiful state, and I've been so welcomed by Bill and his family, and so I've just had a blast. We drove past a house and set it at 20 acres, and I was like, I wonder if Iowa State's looking for veterinary. But here we all are, right? We're all here because through the grapevine, or directly, you heard about the wreck that Bill got into. And it's been in the news, right? Ticks confirmed, disease confirmed. And we tend to have this happen a lot, right? Like we see things in the news, they report like, oh, your mortality rate is going to be high, and this is going to be a disaster, and there's nothing we can do. So hopefully by the end of today, and I'm going to tell you up front, there's a lot of information here. It's going to be drinking out of a fire hose a little bit. You're not going to remember it all. But hopefully you'll get a better understanding of how this all fits together and places that you can protect yourself. And again, if you get halfway and you're with me and then you go home tonight and you think, actually I'm a little bit confused by something and I need a recap, give me a call. Okay, so, here we go. Confirmed by your state Department of Agriculture, it is here. You guys don't know me very well, but I'm an aesthetics kind of person. I have some of my students here. Josh, he's taken my... I have beautiful slides, and I have images on every slide, and I never leave a blank slide. My husband was talking about which car we should buy, and he's talking about V8s and turbos, and it's got the Mustang engine, but it's in this body. I was like, honey, I'm just going to stop you right here. What does it look like? I have put nothing on this slide specifically because this is the most important thing that you need to know right now. This was never an if. Are we going to get it? This was guaranteed from the start that this was going to happen. It was just a matter of when. And now we're at this when, and to be honest, it probably is only because we've now noticed it. It's probably been circulating for a while. It was bound to happen. Now we've got to figure out what we do about it, what have we learned from other states, and how do we move forward. So, this one's kind of laggy. Come on, buddy. Do me a favor and just click the arrow for me. I don't know why he's upset. Just a little side arrow. There we go. Okay. So this is a great map that a colleague of mine out at Oklahoma State University kind of put together and was published in Drover's magazine. This is what I mean when I say it was inevitable, right? So we had the first sort of records of this tick and the outbreak really in Virginia in 2017. But we think that it was here much, much, much earlier, right? And as time went by, you can just see it's just sort of gone westward. It's like the westward expansion, but for ticks. And here you see here, 2023, 2024, 2021, 2025, right? It was coming our way. I'm starting to get really worried about Kansas right now, because now we're We're surrounded. Right, so this was always going to happen. And so it's probably, like I said, being here before, there's going to be people in this audience that already have it, they just don't know about it yet. And because they got it in the right way possible. And we'll talk a little bit more about that. So why did this even happen? And really, it goes down to the fact that this is a really unique tick. This tick has gone and done something that no other ticks do. Gotta stop moving. Okay, so here's the dermacenter tick. So this is what transmits anaplasmosis, right? Very normal tick biology. We have her laying her eggs. Those eggs hatch into a 6-leg larva. The larva feeds on a small animal. It falls off and it spends a couple of weeks molting, and then it jumps onto somebody else and it takes a blood meal. And then it gets here on its 3rd blood meal. And what you need to have is an adult male tick and an adult female tick in the same place, in the same animal, and on the same location. So once a female tick embeds into a host, she can't move. So she secretes pheromones so that the male tick can find her. So she's just hoping. I mean, this is like worse odds than Tinder and all sorts of things, right? She's really hoping that a male comes along and finds her. And then they'll mate, and then she'll drop off and lay some more eggs. So this is what most every tick does. And this is why, despite the fact that we get invasive ticks coming in anytime somebody goes trophy hunting in Africa and they don't spray down the hide properly, you're bringing in invasive ticks. The number of ticks that get caught out at like border control, astronomical. But it never becomes a problem because you have to have a male tick and a female tick at the same place and the same time. Asian longhorn tick, exact same, female lays an egg, 6-leg larva hops onto an animal, feeds, falls off, 2nd stage, hops onto a new animal, feeds, falls off. This is where the problem is. There's no male. She is the ultimate feminist tick. She was like, I don't need you guys. I'm just going to do it all myself. So she makes little clones of herself, which means you don't need a male tick and a female tick to find each other. It also means that every single egg she lays is a female, which means none of those have to find a mate and carry on. Right? So this is why it's spread as rapidly as it has, because all you need is one adult female tick and you've got a population established. This is also what makes them very difficult to control. I kind of like this lab because it makes me think. Okay, so because all you're doing is moving these females who can just make more females of themselves, you're moving these ticks faster than any other insect that we've ever moved has become invasive, right? So if you bring in a potload of calves from Virginia that has had it for many, many years, and there's one tick on one of those animals and it drops off in your pasture, you have Asian longhorn tick. Let's say you're moving cattle, right? Pasture to pasture. You don't know there's one animal that has one tick on it and you move it clear across to another pasture. Now you've gone and established a new population in this new place. And I have to just give a little shout out. This is my horse. He has never seen cows in his life. Actually, no, that's not true. He saw cows once in his life and they were longhorns and he was okay until the horse next to him started freaking out and then he was like, oh no. And then I broke my arm. But we moved him to Kansas, and my neighbor, who has cattle, knows I have a horse, and one day said, hey, Cassandra, you want to come help move cows? And I was like, yeah, I'll come help move cows. And he's like, oh, you want to bring your horse? And I was like, oh, I don't know about this part. So there's Tel and I moving cattle. He got really good at it. He eventually figured out that we can push him. But you know how the whole herd kind of turns around and takes a look at you, and he was like, whoa, I'm out. But I use this in every single presentation because I'm so proud of him. But anyway, the moral of the story is not that my horse can semi-decently move cattle. is that if you move an animal from one location to another and you've got just one tick on it, you will cause a new population to be at that new area. They have an extremely wide host range. They'll feed on anything, they don't care. A lot of our ticks are pretty specific and they want 1 or 2 or 3 species, but this guy doesn't care. He'll feed on anyone, which means if you have a bird on your pasture and it picks one up and it flies 5 miles down the road and it took it 5 hours to get there and that tick decided, okay, I've had enough blood, I'm going to fall off. That's it, you're done. And this is why we've got to be really careful, right? Because if you have an infestation of the tick, if you have an infestation of the parasite, you did nothing wrong. This is not like you went out and you picked it up and you were like, oh yeah, I'm going to totally introduce this invasive thing. The cards were all stacked against us, right? This was bound to happen, it's just who detected it first. So much so that we actually think that the first introduction of this was a pet that traveled to an area where this tick already was established and brought it back in. One single dog brought in possibly one single tick, right? So this is why it's become as much of a problem as it has. So some scientists got together and they decided, well, we should probably figure out how bad it's going to be for the whole of the United States. So they took all the areas where it already exists and said, okay, well, how far did it go? And they basically developed 3 different models. And if 3 out of the 3 models said, yes, this is going to be a great place for the Asian longhorn tick, it's in red. If 2 out of 3 agreed, it's in kind of this orange color. And if only 1 model said, yeah, I think the tick can survive here, it's this lightest color here. So then if we blow it up, right, so there's that westward expansion that we're talking about. Do me a favor, just blow it up. I think it's because we're running too much. And also, like, we should tell K-State, hey, she needs a better computer. Okay, so here we have Kansas, here's Nebraska, here you guys are, right? So the models are predicting that you're not going to get it over most of the state, which is good, right? Look at poor old Kansas. So not everywhere is going to be a suitable place for this tick to be. However, climate change, despite what politicians may or may not say, is a thing, right? Climate is variable. So this assumes a stable climate. If we have temperatures warming, this area is going to expand because they're really sensitive to the cold. So the good news is not everybody in the state of Iowa is going to have to worry about this tick. But some of us are. Okay. I think I skipped one. Okay. So just to make us all feel better about ourselves, this is where the tick originally comes from. This is everywhere in the world that it's already spread. Right? Lots of people are dealing with this. When it went into Australia and New Zealand, we saw similar things to what we're seeing now. There's this period of instability. It eventually calmed down and it just became a regular thing that we deal with like anaplasma. And that's what's going to eventually happen with us. Okay, if we look at the pathogen, it also has followed this sort of westward expansion. But if you look here, look at Kansas and Nebraska. The tick hasn't gotten to us yet, but we've had outbreaks. Because we move a lot of cattle from the East Coast and then we bring them into Kansas. It's like, you know, when your mom's like, I'm asking you once, I'm asking you twice, okay, how am I going to do it? Okay. So knowledge is really powerful, right? Hopefully by the end of this you have a better understanding of what's going on. We can feel a little bit better. The world, we're not chicken little, the world's not falling on our head. We're going to talk about Theileria specifically, how is it spread, how do I know that I've got an infection, what can I treat with, or in this case, what very limited resources do I have to treat it. we're going to talk a little bit about Asian longhorn tick control. What does it look like? How can you control it? We're going to talk about what is your risk of potentially having an outbreak, and this is going to be different for everybody, right? So you're going to have to take pieces of this information and decide what your risk is. And then if you do have an outbreak, what do you have to do? So, as we've already said, Theileria Orientalis has been here for a while. I suspect it's probably been here in Iowa for a while. It's just now a unique set of situations meant that we had a detectable outbreak. So it's been here. There's 3 subtypes. This is the one that we really worry about, the Aikidan subtype. So when you send a sample in to be tested, it'll tell you whether it's the Aikidan subtype. It is the most pathogenic of ours. But to put it in context, there's many other Theileria species in the world that infect cattle. This is one of the mildest, right? We could have it a lot worse. This is really important. Once an animal is infected, it remains a chronic carrier, probably for life, right? It will go below the level of detection, so you won't pick it up on a PCR, but it still has it and can still infect it. K-State is busy working on an ELISA, so a serology test to see, when you do a PCR, all you're doing is testing whether that animal has parasites right now. It doesn't tell you whether the animal was infected 6 months ago. Right? So serology is going to be really important because even when the parasite level becomes undetected by PCR, if you've got antibodies, you can assume that the animal was infected at some point and can go on to infect ticks. Go ahead. Okay. Some of what we're going to tell you, and I'm sure everybody has a lot of questions, we don't always know the answers for this Theileria species, mainly because it's been a non-issue for most of the world, and we don't like to spend money on studying things that are non-issues. So some of what we're going to talk about is our best guesses based on other Theileria species. That's fine. This is ridiculous. Okay, so here's the life cycle. We're going to get a little bit into the weeds, but if you understand the life cycle, you can start looking at your risk profiles. So what happens is you have the Asian longhorn tick, and this is the only tick. We tested other ticks in the United States. This is the only tick that we have to worry about for this. And what it does is that's called a sporozoid. How many of you have seen malaria in the news and things like that, right? It's not really a problem for the United States, but it's one of the biggest pathogens. We're really looking at a cousin of malaria here, right? So every Theileria, whether you infect a horse, a cow, a sheep, a goat, it doesn't matter. Every Theileria has to go into a white blood cell first. This is first stop. Okay. Once you're in the white blood cell, you kind of change your shape a little bit. And for Theileria Orientalis, it doesn't replicate in this white blood cell. Other Theilerias will replicate in the white blood cell, but we don't have to worry about that now. What it does is it goes pretty quickly into the red blood cells. Okay, so then it changes its shape, and then it goes into a red blood cell, and for it to make more of itself, it proliferates in this red blood cell, but you've got to get to a new red blood cell to make more of yourself. So it just keeps going, and it bursts open the red blood cell to get to another red blood cell. Very similar to what we have in anaplasmosis. And this is why we see anemia in these animals. Partly because the parasite is replicating in this red blood cell, but also because the spleen, anytime a red blood cell is infected with something, it changes its shape a little bit, and the spleen's job is to pull out anybody who looks wonky. So the spleen is pulling out the infected cells, which is good, but they're also bursting them open, so this is why we tend to have anemia with these animals. Okay, it's at this stage that it's transmissible by a tick or a needle, right? So remember, because we're replicating in a red blood cell, if I move red blood cells from one animal to another animal, just like what we say, anaplasmosis, if you share needles, you can transmit anaplasmosis, exact same thing. If you have an infected animal and you're using the same needle, you're passing it along. And this is what happened in our outbreak in Kansas. Infected cattle came in from Virginia. The guy used the same needle all the way down the chute to do his vaccinations, and the same order they were in the chute, everybody, this one came down with it, a couple days later, the next one, a couple days later, the next one, a couple days later, the next one. So you have to be very, very careful. Even if you don't have the tick vector, if you have an infected animal, change needles. And this is bleeding if I'm taking a purple top or a red top, but also if I'm vaccinated. And I know this isn't convenient, right? But if you don't want to spread it, this is what we've got to do. Okay, next one. The one thing we don't know is the role of biting flies. So in Kansas, we've got a ton of biting flies. We know that biting flies can transmit anaplasmosis. We don't know for Theileria, but I assume that if your parasite level is high enough in your Theileria infected animal, you could transmit it. We haven't done the studies, but that's going to be my best guess. Okay. You may have cattle already infected and you don't even realize it. So this is a sample that I took from cattle in Galesburg, Kansas. The year before this, he had a wreck. You know, he brought in cattle from Virginia, and I think he lost about 10-15% of that. So then the next year he said, well, I want to see these cattle off from roughly the same place. I want to see how many of them are infected. He was of the opinion that nobody was infected because nobody looked bad and nobody was sick or anything like that. And we tested it and 91% of those animals were positive. Nobody showed any signs of being infected. Right? So most animals will be what we call asymptomatic. They don't show any, and that's the best case scenario. That's really what we want. Okay. This is the second outbreak we had in Kansas, and you see we have different dots. Firstly, you can see that we have a much lower prevalence rate. These cattle came from Missouri and from Arkansas. And if you want to move me a little, so this is one that came out of Arkansas. All the greens came out of Missouri. And this one is the one single fatality that he had. Right? So not everybody that gets infected is going to die. And depending on where you're bringing animals in and out from, you're going to have a different prevalence rate. Okay, go ahead and move me on. When we look at what we've seen so far in Iowa, we're ranging from a 92, sort of a 73% prevalence to a 92% prevalence. This doesn't happen overnight. You have to have a couple of years of it already being here before you have this many in a herd positive. And this is what I'm saying when I'm saying that we've probably had it for a long time, we just haven't noticed it. So, symptoms of infection. The most noticeable thing is that the animals will get a fever and they'll go off feed. This is a little bit different to what we see with anaplasmosis. It's very, very noticeable. They stop eating and they start losing weight. It's very, very noticeable. Lethargy, sometimes they'll sort of sequester themselves off to the side. Anemia. So anemia is very, very common because we're breaking open those red blood cells. Difficulty breathing and coughing. So what we have when we have Theileria infections is we have a lot of lung involvement, and that's actually, at least for their cousin, that's what kills them. So sometimes you'll see the animals standing with their heads down because their lungs are getting congested and they're trying to clear their lungs. Because of this anemia, you can get yellowing membranes. We do sometimes see abortions. And we say sudden deaths, but realistically it's not actually that sudden. It's just the signs leading up to it are fairly subtle, right? And if you're not checking them every day, or you've got a large number, and you don't necessarily know their personalities, you can skip by these signs pretty quickly. It mimics anaplasmosis, right? So most people are familiar with anaplasmosis. They kind of get these symptoms and they think, oh, I must have an anaplas situation. But it never responds to treatment. The difference is that so you know how, one of the signs of anaplasmosis is that animals get a little bit aggressive. So when they get anemia, they can get a little bit aggressive. We don't see this in Theilerias. Theilerias, they go the other way. They get kind of depressed. And different age susceptibility. So in Theilerias, it's normally our young animals who are most at risk, but also older, naive animals. So it's a slightly different risk to anaplasmosis. Okay, so there's a range of mortality rates. And this is kind of when we go to the highs, and I think in the handout, it was really hard to get a handout that would fit Iowa, but I tried the best I can. I think in this one it says sort of like 90%, right? And this is what's got everybody panicked. For most of us, we are not going to have high mortality rates. Most of us will be sitting around the 0% mark, especially if you've had it trickling in for a little while. We tend to have the highest mortality rates when it's first introduced. So anecdotally, when you speak to people who have had it, and this is kind of the experience Bill's had, and we're going to have Laura in a little bit, the first year is really rough, but then it stabilizes and then you don't have outbreaks anymore. So really what you have to do is just get through that first year. You can have relapses of disease. So what we have found is because they stay infected for a long period of time, if an animal that was infected a couple of years ago goes through a lot of stress, you can have it relapse. This isn't in most animals, but occasionally. So that one that we had in the yellow box, that animal came in with it and was a bit lethargic and punky, but it did quite fine. And then they bred it again, and it conceived fine, but because pregnancy puts you in an immune suppressive state, it relapsed. And it just couldn't make it through it, right? So you can have relapses. When we're looking at our high-risk animals, especially if you're in that initial stage, this goes away once it's settled down, but your highest risk animals is animals under 6 months, anybody who's pregnant, really anybody who's stressed. Often we see bulls actually come down with it because when they're running with cows, they're so busy doing other things and they stress themselves out a little bit. But really, when we see the most problems, it's when any animal that has not ever seen it, a mature animal that's never seen it, comes into an area with a high tick burden. It's just because they've got no immune response and they struggle with it. This is not going to be most of the animals. This is sort of the exception rather than the norm. Okay, so treatments were really limited. There is no, even though there is an anti-Theileria drug, it is not licensed for use in the United States because you have to go through all sorts of safety testing and is it safe for people, etc., etc., etc. So, in other Theileria species, if we give oxytetracycline early on in infection, the animals can recover and seem to do a little bit better. We don't know quite why this is. There's been multiple theories as to why this exists. Partly it could be because the oxytetracycline is working on the white blood cells. It could also be that because we see a lot of lung involvement, the oxytetracycline is like a prophylaxis and kind of staving off that secondary infection. We've got anecdotal evidence in Kansas outbreaks that it did help. Very important, it can't be chlorotetracycline, it has to be oxytetracycline. Ivermectin will reduce incidences of disease, but only if you have the tick present. If you are passing it needle by needle by needle, it doesn't matter how much ivermectin you give those cattle, it's going to do nothing. Because the ivermectin kills the ticks, which lowers the infectious dose an animal gets. And we'll talk about ivermectins in a little bit, because this doesn't mean that we just want to go be giving everybody ivermectin. The two most important things is that it's going to kill all your dung beetles, and most of us care about the dung beetles. We are rapidly getting resistance to insecticides in our fly populations. You guys have horn flies and face flies and staple flies. If you don't have dung beetles bearing that manure, and tags stop working and sprays stop working, then we've got no fly control issues. We're also worried about long-term resistance in the wood populations. So really, keeping animals stress-free, happy, well-nourished is the best thing that you can do, so let's not be skimping on that. We want to keep a really close eye on animals undergoing high-stress events, like if they just got brought in, so shipping issues, any animal that is pregnant. Keep up to date on other vaccines, right? Because immune responses are very costly things to maintain. Don't make it have to fight preventable things, right? If there's a vaccine for something, don't make it have to fight that off. So, lots of information so far, and you're probably thinking, okay, well, what's my risk? short of me visiting absolutely every one of you, we don't know, but we're going to try and piece it together. So, I want you to think of a, three-legged bar stool, right? So, if you have one leg missing of that chair, what happens? Pops over, right? If you have two legs missing, it pops over even faster, right? Okay. So, now, we're going to use this analogy for the situation that we're in. If we flip this bar stool over and here's the three legs, it forms a triangle. And whether or not you have a complete triangle is going to determine your risk. So, three sides of the triangle are, we've got Theileria Orientalis, which is our pathogen, we've got cattle, and we've got the Asian Longhorn tick. If you get all three of these things in the same place at the same time, you'll have transmission from animal to animal to animal. Right? So, if you have Theileria Orientalis infected Asian Longhorn ticks, let's say a bird brought it in or a raccoon scurried over, but you don't have cattle, you only have two out of those three things. So what happens? Your chair pops over and you don't get transmission. Let's say you have you brought in cattle from out of state, and you have cattle and they're infected with Theileria Orientalis, but you don't have the tick vector. Again, we've only got two sides of these in the chair falls over. Okay, so unless you start doing silly things like sharing needles or stuff like that, you should be fairly safe. If you have all three, you have the pathogen, you have the tick, and you have cattle, it's going to circulate within the herd. That's not necessarily a bad thing, right? Because once animals get infected and they survive that initial infected, they're pretty set for life. So it's really figuring out how many sides of this triangle I have and whether I want it to complete and have within herd transmission, or if I want to stay where I am. And that's really dependent on where you're at now, whether you have the tick and whether you have infected cattle. So how do you know if you have the tick? So it's a little brown tick, no distinguishing markings, right? It's just a little brown jobby. You're most likely to see them on animals. And you'll notice them when you get abnormally high levels of ticks. And I was just chatting to Bill when we were driving, and I was like, this is the first time I've seen it in the wild too, so I'm a little bit excited about it. But I was like, everybody says, oh, you just see crazy high amounts of ticks. I'm like, yeah, but what's crazy high amounts of ticks? And then we were out there, and I was like, oh, that's what crazy high amounts of ticks are, right? It's noticeable. You will notice it. The ticks will be clustered together, so ticks feed more effectively when there's lots of them in the area, so they sort of secrete these pheromones to call everybody to the same place. And many of them will be grey and engorged. So this isn't the Asian Longhorn tick, this is the African cousin, but this kind of thing, right? You'll get the fat grey ones, and you'll see more of them than you've ever seen before in an animal. Now this is the problem, right? We only notice that we have a tick problem when we get to infestation levels that are too high. Okay, so go one back. This is what they look like. So this is my finger right here. This is a little larva. Teeny tiny brown jobby. Nymph, a little bit bigger, but still a little brown jobby. Okay? And that's the adult. Nondescript brown tick. Every single one of those ticks is going to go on to lay a couple thousand eggs once she gets to an adult stage, right? Remember, we don't have a male in this situation. Okay. This is what it starts to look like, right? So you see how this is the ear of the animal, and you see how many we've got clustered together, and you see how they're the gray ticks? It's because each one of those is a female for the most part, right? So she's going to take large amounts of blood. This is also... most ticks, you can never kill an animal by having too many ticks on them because they just don't take enough blood. This is the exception because everybody's a female, which means she takes a lot of blood. Smaller animals are at risk of having too much blood taken out. Okay, so here again on the tail of the animal, you see all of these ticks here, brown, starting to get grey and engorged. Here again, clustered on the side of the leg. So here's kind of in the folds of the skin, and you can see kind of how there's so much tick activity that there's actually blood seeping from those wounds. One of the things that tick do is they secrete what an anticoagulant so the blood keeps flowing, but sometimes you just have some of that spewing out. It's really not fun for anybody. Here is Aedes dewlaps. So abnormally high infestation levels. So tick control options. This is when, you know, my job becomes a little bit harder because there's no one size fits all, right? I'm going to say something, you're going to be like, there's no ways I can do that, right? So you're going to have to pick which ones you can use. And then the second thing to remember is that every single thing you do is going to have a risk and a reward. Kind of like how my mom used to say, actions have consequences, right? Everything that you do is potentially going to have some consequence that we want to stave off. Okay, burning. Come from Kansas. Anybody who's been in the foothills knows we like to burn things, right? Burning in the spring, especially in the spring before those ticks can finish overwintering and come out, is very, very effective for tick control. You just dehydrate and burn them. So this is Kansas. I took this spring, right? That's the extent that the foothills is on fire every single year. Kansas hasn't had the tick yet. I don't know, maybe it's a crazy idea, but I think partly it's because we've stopped that westward expansion because we burn. Maybe I'll be wrong. So go ahead. So burning is only effective in areas that physically get burned. So this is two areas, and so you're going to go next. These are only 100 yards apart, right? This area was burned properly. This area was too green, it didn't carry the fire. And so what you see is that the unburnt area kept its tick population, and the area that was burnt didn't. Right? So it only is effective where you physically burnt the grass. Okay. Clear brush and hedge areas. These ticks love trees. They love treed areas. Especially these eastern red cedars. Eastern red cedars put off more water vapor than other trees, and so it's a really, really humid environment. It's a tick hotspot. It's a mosquito hotspot. It's anything that we don't want hotspots. And animals just love going into there. So keeping grass short, this may be more practical for some people than other people. If you keep grass short, then the sun gets onto it and burns it, and it dehydrates the area, which means that ticks find it hard to survive. Everything that we're going to try and do is going to make life hard for the tick. You can put ear tags in, especially if you've got ear involvement. Not every animal is going to have ear involvement, right? So if you see lots of ticks on the ears, if you put ear tags in, it's going to help. If those ticks aren't in the ears, it's not going to help. So the way an ear tag works is it's a plastic, and the insecticide is in the plastic, and so it has to move from the plastic onto the hair of the animal, and then it gets spread out. That's why they work for face flies, and that's why they work for horn flies, but they don't work for stable flies, because stable flies are on the leg. So it has to be an area where it can contact. If you do use ear tags, and this is just general good practice, you have to tag both ears. Often in the box it'll say, well, tag one ear for adequate control and 2 ears for excellent control, and you think, well, these tags are kind of expensive, I can do it adequate. You only coat one side of the animal if you only put in one ear tag, which means the whole other side of the animal is completely free, and you can have insect populations. Don't daisy chain. So these aren't insecticide ear tags, but it really gives the point pretty well. So if you put your insecticide ear tag, let's pretend that it's this one, into an existing ear tag, you spent money on the ear tag and it's just flowing in the wind, right? If you look at how little of this ear tag actually contacts the animal's skin, all you've got is that little tip point that is putting insecticide onto the animal's coat. Okay, if you are going to use ear tags for anything, you're going to want to rotate annually. So year 1, use a pyrethroid. Year 2, use an organophosphate. And year 3, use a macrocystolactone. We have horrible, horrible levels of resistance to our insecticides. This slows it down a little bit. We can get into a whole thing about ear tags if you guys want to. But for the purposes of this talk, just make sure that you rotate annually. And here's your options, right? So let's say this year you put in a Guard Star Plus. Next year you're going to want to move over and you pick one of these. Maybe you say, okay, I'm going to use a Corathon. Following year, you're going to use something else. And then you're going to loop back. Year 4 is going to go back into purple. We need to be better about making choices. Sometimes we're just like, oh, well, yeah, I've been using Python tags for the past couple of years. They've been working great, so I'm going to use it. Every time you give the tick or the fly or anything, any exposure to it, you're saying, here's something that could kill you. You're going to want to think about getting resistance to it. Rotating annually slows that down. And I really like, this is not a plug, I'm not affiliated with Vitex anyway. They make it hard for you to know who's in what group. Vitex has done a really good job because now they're putting the numbers on the box. Right, so it helps you when you're making your selection. Okay, anti-tick vaccines. This is something, and I'm just going to tell you next because there's a whole animation here. Okay. So how this works is, in the lab, we figure out what is important for a tick to survive, and then we make it, and then we inject that into cattle. The cattle then make antibodies to it, like they would with any vaccine, and then the next time that tick feeds on that animal, it consumes those antibodies with the blood, and those antibodies will attack the tick. This doesn't always kill the tick directly on the animal, but it leads to a population decline over time. And if we're looking at something like the Asian Longhorn tick, where everybody's a female, that is a option that we have. Okay, so some caveats. So go ahead. There is an anti-tick vaccine available from Meiji. It is only available from your veterinarian. So I can't even tell you how much it costs because your veterinarian has to call them up and say, hey, I want so many doses. They've done a good job in selecting candidates that should work, but Meiji has not done any trials to see how effective it is. I'm not saying that it does work, I'm not saying that it doesn't work. They just haven't done the studies. The other thing that you need to keep in mind is that you're going to have to revaccinate animals every 6 months to keep those antibody levels high enough. It's not a terribly expensive vaccine, but I can't tell you whether it works or not. I'm just giving you the options, right? You may or may not choose to use it. Okay, pour-ons and sprays. And this is kind of cool because we kind of saw this in action. So a pour-on will work, but only if it's an ivermectin. So the way an ivermectin pour-on works is you pour it along the back of the animal, it gets absorbed into the bloodstream of the animal, and it circulates throughout the body. So you pour it on the back, but it'll get to the udders and the tail and the legs and the head. If you use a pour-on that is not a ivermectin, so something like permethrin, an organophosphate, or a pyrethroid, it will kill ticks in the area that you poured it on in the back, but it will not kill ticks that are not in that area. So you've poured it on the back and it'll kill anybody who's on that back area, but anybody you've got on the dewlap, anybody you've got on the udders, it's not going to work. So keep that in mind. When you do a pour-on, you're going to want to make sure you get a good weight on the animal. And I understand, everything I tell people to do is like, God, that's going to take me some more time. It's important though. If we underdose animals, it means that the ticks are taking a lethal dose of the poison, and they're going to develop resistance faster. And that just means that we run out of options. We are really in control of how quickly these ticks develop resistance. You want to apply it from head to tail. This is especially true if you're using it for hornfly control. So this kind of goes back to what I say. If you pour it along the central line, it's not going to impact any of these ticks anywhere else on the animal. Okay, that brings us to our next thing, which are injectable ivermectins. This is like our nuclear option. And I really want to emphasize this because everybody's going to be like, oh, ivermectins, gets absorbed, long range. We're just going to give everybody long range. We really don't want to use this until it's our absolute last resort. The reason being, this is when you inject it, you have a high amount here, and then it trickles down over time. So now, go ahead. When we tested with a long-range work for hornfly control, we got knockdown of hornflies for 100 days. Once I've injected something into an animal, I can't take it back. If I put an ear tag in and that ear tag stops working, I can take it out. Once I've injected it, it's in there. So we have this long tail period here. And they just stopped at 150, it goes on for longer. We've got this long tail period where any fly, any tick, any gastrointestinal nematode is exposed to this compound, but it's at sublethal doses. So we don't want to, and especially if we think about it from this perspective, like Theilerias will eventually sort themselves out and we'll get to a stable situation. If you've got macrocyclic lactone-resistant hornflies, that's going to cost you more money every single year till the end of time. So please, don't just be like trigger happy with the injectables. Okay, next slide. This works really well. It's funny. This is what we do in Africa. We spray things, right? We have way more ticks than you guys do. A spray will work because you're getting the insecticide everywhere where that tick is. So if you have any ability to spray them, I would recommend spraying them instead of doing something like an injectable. Pasture spray. So over here, if you go one forward, that's the little tick there. Ticks are really sensitive to drying out. So what they do is they climb up the grass and they wait for it. And I just think it's kind of cute because what they do is if you watch it, because I watch ticks, go like this. They're putting their little arms up in the air because there's a little sensor on the front part, and what they're doing is they're smelling the air around them and they're looking for something. It's like, pick me, pick me. When things get warm, they'll move down into that grass where it's nice and protected. If you have tall grass and you're worried I've got too many ticks and you fly over with your plane and you spray it, that insecticide is not getting low enough. So you're wasting money, you're wasting time, and you're probably killing any beneficial insects that you have around. You have to have short grass for this spraying to be effective. So you want to cut your grass first and then spray. And again, this is a little bit more the nuclear option. Okay. The other option that you have is honestly just let nature take its course. So this is the African cousin. You see, I don't know if you guys can see this very well, but you see how these ticks, every single one of them are nice and gray and they're same size, everybody looks happy. These ticks fed on an animal that had never seen these ticks before. These ticks fed on an animal who had seen them before, and only once before. And you can see that they're a little bit smaller, but also there's some of them that are a misshapen color. So here you can see it a little bit better. The animal, over time, develops a resistance to ticks. When ticks then feed on this animal again, the ticks don't survive. Because Asian longhorn ticks are available in such big numbers, your animal will develop an immune response. And I thought it was so interesting, Bill was kind of describing what happened, and he said, well, they had them on the ears and then we knocked them back, but then they didn't come back to the ears, they came back to another area. So remember those pictures that we showed and there was just ticks everywhere? because they put so much stuff into that body, this, I think, I have absolutely no data to back this up, but this is what I think is happening, is that the skin in the affected area becomes not a good place for a tick to be. So then he'll find another place, and then they'll move in that new area. So over time, I think that animals will start to be able to regulate those burdens a little bit better. Okay, so what you do if you suspect you have an outbreak, remember you're going to look for animals that are lethargic, they've gone off feed, they're looking a little bit skinny. Take a blood sample. Worst case scenario, you just took an extra blood sample. Take a red top and a purple top, at least then you have it, right? You can send it off to be tested if you need to. If the animal is dead, go ahead and take a spleen sample. Submit it to an accredited laboratory, right? I submit to K-State all the time. You guys have an accredited laboratory in your lab, in your state, you can submit them to them. Collect any ticks you have on the animal, and you want to put them into 70% ethanol. This is going to kill the ticks. And then you can submit it to the diagnostic lab, or honestly, call me. I'll identify your ticks for free. If you guys are really worried, go around into your pastures and collect some ticks and submit them to me. Just make sure they're in the ethanol, because we don't want to be bringing it into Kansas. Okay, if you get an animal that died, and you have had a diagnostic lab, an accredited lab, test that animal and says, yes, it had Theileria Orientalis, you can submit for partial repayment from the Livestock Indemnity Program. You can get some money back. This is not going to last forever, right? Right now we're doing it because it's kind of a novel thing. When most of the country has this, like you don't have indemnity every time you lose an animal to anaplas, right? This will eventually go away, but if in the meantime you have a situation where you incur significant loss and you can prove it was Theileria, you have an option. And so the last thing that I'm going to do is talk about creating endemic stability. And this is a word that we use. So right now we're in outbreak situation and it's unstable. We're all going to slowly, hopefully, move to a thing called endemic stability. Okay. If you have both the tick and the pathogen present, this is your best outcome. These ticks are very hard to control. Prevalence rates in herds are very high. You want to get past the outbreak stage and get to endemic stability. What you want is for young animals, so while they're still nursing, to be exposed at a low level. Because if they come from a mom who's been exposed, she'll give maternal antibodies, which will give it about 6 months of coverage, and then you want it to get a little bit of parasite exposure naturally from a tick. To do this, you have to keep some ticks, and you have to keep infected animals. But what happens is, the young animal is protected from the maternal antibodies, he gets an exposure, and I want you to think of it kind of like a race, right? With Theilerias, it's dose dependent. If I get one parasite, I tend to get milder disease than somebody who got 100 parasites. Who would have milder disease than somebody who got 1,000. So we want to give that low dose of parasites so the immune response can keep up. You always want to be careful, if you have both the tick and the parasite present, that you're very careful with animals that you bring in that have come from areas where this isn't present. So, mostly animals from the West. You want to keep some ticks so that you have constantly source of infections. And really what you want is constant pressure, everybody ticks along. You should never have any animals come down with symptoms of disease. What if you don't have the tick? Well, if you only have the pathogen present, right, you've only got one out of these 3 legs, you can keep those animals just fine. They conceive just fine, they do just fine. It's the rare animal who gets somewhat stressed and goes downhill, but for the most part, they're happy, they're healthy. Your goal is just to keep anybody from relapsing. If you have infected cattle, and the tick is in your area, you need to start thinking about, okay, eventually it's going to come to me because like anybody can bring it, any bird can bring it. We just want to make sure that we are keeping an eye out on those animals, maybe pay a little bit more attention. drive through the herd a little bit slower, start to see if you've got anybody who's losing weight. If you are in a super low risk area, anybody in the map who had no color of red, orange, or yellow, and you brought in cattle from out of state and they were infested and they're not super high value, you just want to move those animals along. One of the questions we get kind of is like, okay, well, what's my responsibility, right? If I have an outbreak and I now know that I have it, do I tell the people I'm sending them on to, or do I not say anything? And this is a tough one, right? Because what if they say, well, no, I'd rather not have your animals? But I think we've got to think about it, well, what if I brought in animals and the person knew that they were infected, that they didn't tell me, and I had a wreck? Right, we want to be good neighbors, we want to be good stewards. So I do think it's important to be upfront and say, hey, these animals tested positive, they haven't had any issues, just know that they're coming in. I guarantee you Kansas is still going to buy stock of cars even if they're infected, right? We're not going to say no, we're not going to take anybody. So if you are in a low-risk area, you can go ahead and remove those animals if you want to have none of the three present. Good standard practice, and this is whether it's Theileria or anything else, right? Be aware of animals coming in from any other region. Right? What does that region have? Is it something that I have? Is it something that I need to be on the lookout for? If you have a closed herd, test animals that come in. Right now, all we've got is the PCR test, which will only tell you whether it's carrying pathogens right now, but hopefully we'll have the diagnostic ELISA in a little bit, and so we can say, okay, this animal was infested at some point. And then I can say, oh, well, I'm probably never going to have the tick, so as long as I don't share needles, I'll be good to go. It's all about evaluating those risks. Stay caught up on tick prevention, but again, we don't want to go overboard, right? We don't want to panic and everybody goes home and now I find out that I was sold out of long range because everybody's injecting, right? We want to think about this as not just putting out today's fire, but how do we stop fires from spreading? Always good practice, just keep animals low stress and healthy. And just really be vigilant. So the unfortunate thing is that you can have this tick for a couple of years and not know it. You will only notice it when infestations become noticeable, right? So just pay a little bit of extra attention. And if you see, that looks like a little more tick than I'm used to, don't just carry on going with your day, right? Investigate a little bit further, give me a call, we can always figure something out. Okay. This is Ninja. I love Ninja because Ninja is scared of everything in the world, and I use this in every other talk too, because don't panic. The worst thing that we can do is panic. This is entirely manageable. It's going to establish itself. We want to make sure that everybody just skips the wreck. We want to skip the wreck, and we want everybody to go straight to stable. And that is possible. Here's my contact information again. Please do reach out. I don't just say that. I love extension is my favorite part of my job. I'm always very, very excited when I've given a talk and somebody calls me up and says, you know, I have this situation, or hey, you talked about ear tags. I want to look at ear tags, or I want to look at something else. So please, please, please do reach out. I don't know if there is another slide.
That's it.
That's it.